Do you know the rules and requirements for managing a CCM program? In this video, we'll go over the general rules and requirements of chronic care management so that you'll be set up for success. Hey, this is Jake from ThoroughCare. Here at ThoroughCare, we specialize in helping practices manage, bill, and streamline reimbursements for value-based care programs like chronic care management. CCM is a Medicare program that manages the chronic conditions of patients. In order to offer this program, it is important for providers to understand the rules and regulations associated with it. While we aren't going to discuss the specific billing CPT codes in this video, you can check out our video of the current CPT codes for CCM right here. So, what are the provider requirements for chronic care management? First, the patient must be diagnosed with 2 or more chronic conditions to qualify for the program. A chronic condition is considered chronic when it is expected to last at least 12 months or until the death of the patient. Some examples of chronic conditions can be, but are not limited to, diabetes, hypertension, heart disease, heart failure, COPD, and asthma. Before you can begin billing for CCM services, an initial visit is required for new patients or patients who the provider hasn't seen within 1 year. This can be a face-to-face evaluation and management visit, or an initial preventative physical examination as part of an annual wellness visit. At this time, the provider will discuss the benefits of chronic care management and why the patient is a good candidate for these services. The provider must also get the patient's written or oral consent before billing for the program. This is to make sure the patient is aware of factors such as cost-sharing responsibilities and to let them know they can choose to stop the CCM services at any time. Another important requirement of CCM is to create and maintain a comprehensive care plan for each patient in a certified EHR. Along with being available 24/7 to these patients and caregivers, these care plans can and should be shared with providers and others who are involved in the patient's care. Lastly, you or a member of the patient's care team must spend an additional 20 minutes of non-face-to-face clinical staff time per month with each patient in order to bill for these services. A few examples of non-face-to-face interactions include, but are not limited to, phone calls, referrals, chart reviews, care transitions, and scheduling appointments. In addition to the general rules and requirements of the program, it is important to know who can bill for CCM care. Physicians, certified nurse midwives, clinical nurse specialists, nurse practitioners, and physician assistants can all bill for services provided to patients who are enrolled in a CCM program. As you can see, there are many important factors to keep in mind when offering a chronic care management program. If you're interested in how ThoroughCare can help you set up and manage your own CCM program, please reach out using the link below. Please click like and subscribe to our channel to learn more about the many value-based care programs we offer. Thanks for watching.